One of the best treatments for health anxiety is exposure, facing your health anxiety fears head on. But facing your fear head on can often feel overwhelming, and one of the best ways to address facing your fears is by doing exposure therapy in small, manageable steps. And in a previous video, we talked about how to break down fear or anxiety into small, manageable steps using a gradual exposure step ladder. And once that's done, it's then time to actually take steps and to put exposure into action. And so in today's video, we're going to be focusing on how you actually do the exposures to climb the gradual exposure ladder, looking at how to approach each step, how to manage the anxiety that comes with each step in exposure, and how to deal with the challenges that can happen along the way. So the first thing you need to do is to plan your first step. You've identified all of the steps in your ladder, and you're at your first step, but where do you go from here? How do you take that first step? Well, what can be helpful is to set a specific date, a specific time, and a place that you're going to do your first exposure. And what this does is it gives you a clear plan and makes the process feel more concrete. So for example, if my first step in the exposure ladder is to stand in the medicine aisle at the supermarket, I might decide that I'm going to do that on a Saturday at 10 a.m. and I'm going to do it for 5 minutes. The more specific I make the plan, the better, because it's easier to follow through and it helps hold me accountable. One of the key ideas is to ensure that you start small. Now, it might feel like a waste of time to tackle something that seems really easy at first, but it's the small steps that are the building blocks of exposure. The small first steps that get you used to the discomfort and the anxiety that comes with exposure. And so when you face more and more difficult situations, you're better prepared. It's important to remember that each step in the exposure ladder is designed to help you collect evidence that helps you challenge those health anxiety provoking thoughts and helps you build your confidence to move on to the next step. So it's important to understand, let's be really clear, you'll likely feel anxious when you take that first step in exposure. That's entirely expected. In fact, the goal of exposure isn't to avoid anxiety, but to experience it and to get used to it. When you expose yourself to something that you're anxious about, it's natural for your anxiety to go up at the start. But the longer you stay in that situation, your anxiety plateaus, and then it eventually goes down by itself. You don't have to do anything about it. It will just go away naturally. So you can think about it like riding a wave. At first, the wave might seem overwhelming, but if you can ride it out, the intensity of the wave eventually decreases, and that wave of anxiety eventually passes. And the more you do it, the more you learn, and the more you're teaching yourself that anxiety isn't dangerous. It's uncomfortable, yes, but it's not dangerous, and it's something that you demonstrate to yourself that you can actually handle. So if I'm working on overcoming health anxiety or health fears related to contamination, my first step might be to stand in the medicine aisle of the supermarket without touching anything for 15 minutes. The idea is that I need to remind myself that I'm likely to feel increased anxiety in the moment that I step into the medicine aisle, but my goal is to stay there for long enough that I start to experience the anxiety going down. This may take a few minutes, but eventually I start to notice that the initial wave of anxiety starts to fade. And the key thing is that you need to stay in the situation until your anxiety begins to go down. If you enter the situation, your anxiety goes up, and then you leave the situation at the peak of your anxiety, what you tell yourself is that the situation was really dangerous and that you needed to escape it, which just makes it even harder the next time you try to do exposure to that same situation. We call this sensitization. So to avoid sensitizing yourself, what you need to do is you need to stay in the anxiety situation until the anxiety starts to go away on its own, which it will. You just need to give it some time. Now, another important part of this exposure process is reducing or eliminating what we call safety behaviors. Sometimes when we do exposure to feared situations, we do so with certain precautions or safety behaviors, safety nets that we set up for ourselves. So, for example, I might carry around hand sanitizer everywhere just in case I brushed by something, or so I can immediately sanitize my hands and feel better. Once again, this type of behavior might be comforting and relieve my anxiety in the short term, but these types of safety behaviors prevent me from fully facing my fears, which is what I'm trying to do with exposure. So if I'm in the medicine aisle of the supermarket, I might find myself there with hand sanitizer in my pocket, or I might avoid touching any of the items on the shelves. So the idea is for me to start challenging the safety behaviors by doing things like leaving hand sanitizer at home when I go to do the exposure, or pick up different products off the shelf and reading the label as part of my exposure. And what this does is it helps expose me more fully to my fear of contamination in a controlled and manageable way. And if you find that dropping a particular safety behavior feels too hard at first, that's okay. You can gradually reduce it over time as part of the graduated nature of exposure. So for example, if I'm always used to carrying hand sanitizer, maybe what I do is I go out with the hand sanitizer for a short period of time and then gradually build up the amount of time that I'm leaving the house without hand sanitizer. So the idea of graduated exposure and eliminating safety behaviors is about doing it in a structured, gradual, one-step approach, one step at a time approach. This isn't about leaping to the top of the ladder. So we start at the bottom of the ladder with what seems like the least difficult step, and you work your way up. As you move up the exposure ladder, your distress ratings for each step will increase, but the more you do exposure to these situations, the more you get used to that anxiety, and the more you recognize that you can handle it, and the less daunting the next step feels. The key is to repeat each step again and again until it feels manageable. You may need to go over the same step multiple times before you're ready to move on. You might find that you do it so often that you get bored. And if you do find yourself getting bored, that's a good sign that you're ready to move on to the next step. Because anxiety and boredom can't exist at the same time in exposure. And so it's important to repeat each exposure step again and again until the step in the ladder doesn't really cause you very much anxiety and you move up. Repetition is crucial because it helps you feel more in control when you're doing the exposures. If you do a step only one time, the anxiety might tell you that you only got through it by luck, or it's not going to go as well the next time. But the more often you do the exposure at that step, the more you're collecting evidence that you can do it and that the anxiety isn't so bad and that you can manage the anxiety, which then helps reduce the anxiety of every step. And you might be wondering, what happens if something goes wrong while I'm doing exposures? Maybe I attempt an exposure at a step and it doesn't go as well as I had thought. Maybe I feel overwhelmed or so anxious that I can't stay in the situation and I have to leave. Well, it's important to recognize that setbacks are a normal part of this exposure process. So if you find yourself in a situation where a particular step feels too hard, what you might need to do is to create a bridge step, which is an exposure that fits in between the step that you're struggling with and the previous step that you've been able to successfully do exposure to. So for example, if I find it too overwhelming to visit my doctor's office, what I can do is to create a bridge step, like going to a walk-in clinic and sitting in the waiting room of the walk-in clinic until I feel less anxious. The smaller bridge step can help build my confidence to then allow me to take that next step of actually visiting my doctor's office once I've become more comfortable with sitting in the waiting room of the walk-in clinic. Another thing you can do, you can try to do when faced with a setback, is to go back to a previous step and redo the exposures at that level. Once again, what you're doing is you're building your confidence and you're getting used to experiencing anxiety in a controlled way that doesn't get out of control where you feel like you have to escape. The key thing is that you keep moving forward and keep doing exposures, even if it's at a slower pace than you had planned or at a slower pace than you would like it to be. You don't want to rush through exposures, but at the same time, it's important to keep pushing yourself to do exposures to make sure that you're moving up the exposure ladder. And one thing you can do that can help motivate yourself as you do these exposures is to recognize and to acknowledge your successes. Every time you complete an exposure step, what you're doing is that you're proving to yourself that you are capable of facing and overcoming your anxiety. So every once in a while, make sure you take a moment to think about how far you've come with the exposures. You might find that something you consider would have been impossible a few months earlier is now something that you can do with relative ease. And by reflecting on that, it can be a source of motivation to think about where you could potentially be in another few months if you continue with the exposures. So exposure therapy is a gradual, persistent process. You're not going to be able to overcome your health anxiety with one giant leap, but by slowly and steadily facing your health anxiety fears, doing this gradual exposure, you're allowing yourself to overcome your health anxiety in the fastest way possible. It takes patience, it takes effort, and it takes persistence, but it really does work. And if you want to learn more about how exposure therapy can work for various different anxiety disorders, I'd encourage you to check out this video. So that's all for today's video. As always, thank you for making it all the way to the end of this video, and I will see you in the next one.